So the Clinician is a healthcare company that was founded by clinicians for the purpose of accelerating value-based healthcare and also supporting the improvement of health outcomes internationally. So today, specifically, what we support healthcare providers, payers, and policymakers to do is to digitally collect, analyze, and ultimately make sense of patient-centered health data. So that includes outcome measures, PROMs, experience measures, PREMs, and lots of other patient-centered health data that may need to be collected. In terms of where we are and the recent success stories that we have, we're really proud that we've been able to make a global impact for millions of patients who have been reporting their outcomes for the providers and healthcare partners we work for, and for thousands of healthcare professionals who have used that information to ultimately make better clinical decisions. So we've been really proud to have a global impact, and some use cases or success stories from a patient's perspectives. In Saudi Arabia, we've been really proud to support elderly patients report on the effect that cataracts have had on their life, and ultimately support ophthalmologists for those cataract patients make decisions based on their patient-reported outcomes. In South Australia, we're supporting the statewide implementation of patient-reported measures there, and one example and a really positive use case recently was the measurement of pre-treatment anxiety for radiation oncology patients, and finding out that them reporting their distress before treatment is actually being able to impact better clinical decision and proactive care for those patients. So those are just some examples of the positive use cases and patient stories we've seen with our implementations. So while we work with iTrom internationally, there is a really fantastic opportunity in Australia and New Zealand. We're seeing some really positive regulatory shifts in Australia specifically that are promoting outcomes measurement. And what we're seeing is organizations across Australia actually investing in the digital infrastructure to make outcomes measurement happen. And so for us in iTrom, being able to set the standard of what matters most to patients and build those outcomes frameworks and then implement with the digital infrastructure that's being put in place, we think there's a real amazing opportunity to forward value-based healthcare implementation there. In New Zealand, there's been a lot of significant healthcare reform recently, but what they are building is a more integrated, accessible, and equitable health system in New Zealand, which in the future, I think, sets the foundations for value-based healthcare there as well. So working with iTrom, we want to raise the awareness of the standard sets, build a consensus around what matters most, and then implement to collect and analyze and use that data. So our collaboration with iTrom has been going on for more than 4 years now. We've really followed their journey since inception, but our partnership is now, I think, coming on 4 years, and we collaborate in a number of different ways. So from iTrom's perspective, we really rely on the evidence and rigor that exists within their standard sets, and often for the organizations we work with that don't know where to start on their outcomes journey or value-based healthcare journey, we'll point them towards iTrom as a really fantastic starting point. On the flip side to that, iTrom trusts us as a capable implementation partner and technical partner. And so what we've found is we've been able to establish really amazing new relationships with healthcare providers and payers thanks to the introductions from iTrom. And then, of course, there's amazing opportunities like the conference, which bring together such an amazing, diverse audience, and a number of different ways that we're collaborating with respect to learning collaboratives and other opportunities. The iTrom conference is a very unique opportunity to collaborate with the global value-based healthcare community because it has a real patient centricity to it, which I think is a differentiator with this conference. And it really does bring together a global audience from all around the world with very different perspectives, whether that's the provider perspective, patient perspective, as I said, payer perspective, and of course, policymakers as well. So it's unique for us being able to interact with all those different people. And I think the learnings that we've seen this year, building on last year and the previous years that we've attended, has been, really inspiring to see. And you do see a shift from thought leadership and theory into practical implementation. And that is really pleasing and inspiring to see for us trying to support that implementation journey.